Well, good morning and welcome to the Career Transfer Center. My name is Scott Finn. I'm a counselor here and also coordinator of the Career Center. We have a great panel of presenters today, and in a few minutes I'm going to let them introduce themselves, tell you just a brief maybe bio about how they got to where they are today, and then we'll have them go a little bit more in depth and talk about their specific career pathway. So yeah, just relax, get a good seat, make sure you can see the screen here. We have a packet that has some very important information in it. One thing is a 4 gigabyte thumb drive that talks about enrollment priorities, and you can use it also to save your homework and other resources on there. There's also labor market information about some of our top career fields here in San Diego that just came out in October. And then there's a half sheet that talks about 10 tips, things that you can do to really hone in on what career might be best for you. And on the bottom of that half sheet that's on the right-hand side of your packet is a link to the Health Workforce Initiative, and it's a really great resource. And so if we leave today with the questions answered, great. If you want more information, I definitely recommend you start with this particular website and look at the links and the pathways, and you'll really find some great resources. So the panel presentation is to go till about 11 o'clock. There are tables on the outside part of our building here with representatives from different universities. And I also have a guest speaker that's just going to come in and promote a workshop that is coming up for those interested. So if you're thinking about careers in medicine, like pre-medicine, or careers in pharmacy, it's called the MEDS Conference, and it's sponsored by UCSD. And so I have one of the promoters that's going to come up here and give a quick speech. So here she's coming up with a very nice poster here that she wants to share with you. So this is Kat, and she's going to talk about the UCSD Med Conference.
Good morning, you all. So my name is Catherine. Thank you. And I am the conference coordinator for our MEDS conference. And so MEDS conference stands for Medical Education for Diverse Students, and we're in our 3rd year running right now. What we are is we're an all-day conference for pre-med and pre-pharm students, and we're going to be offering both hands-on workshops at the UCSD Schools of Medicine and Pharmacy, and then also workshops on to get more information on how to apply to medical school and pharmacy school. So if that has ever been your interest, we don't require any prerequisites or any pre-preparation for it. If you've ever had an interest in it, this is the conference to be able to get you more exposure to it. We've actually been giving priority registration to community college students. It's both for UCSD and community college students. That way, just to kind of bridge UCSD with Greater San Diego, and really a way to get you all exposure to either the pre-med or pre-pharm experience. So basically if you're pre-med, you're going to be at the UCSD School of Medicine, and you'll be getting basically an idea of what it's like to be a medical student. So you're going to be working with both medical school faculty and medical school students that are there currently. And the same thing for the pharmacy schools as well. If you're interested, I have my table right there, and I have flyers with the registration website and access code. So if you try to go to our website, which is meds.ucsd.edu, you're actually not going to find the registration website because we don't want, we're still trying to get priority registration. So right now, for example, we've recently opened up the registration website to UCSD students. So don't be confused if it says it ends November 15th, you can still get access to register. So there is a $20 registration fee. However, don't be scared. There is financial aid. So if you can't front the money to be able to come to the conference, that's why we have financial aid money to be able to cover that for you. So if you can email me your financial award letter stating you either have the BOG or you have an ESC less than $0, then or less than 2,000, okay. And that I could get you either a fee waiver, which would waive your entire cost as you're registering, or a fee reimbursement after you register. I do have to give a disclaimer. Since we've already opened up the registration to UCSD students, it does fill up fast. Both past 2 years, we've had waitlisted, so we've gotten students waitlisted. So I have to tell you that the hands-on simulation workshops in the morning, they do fill up quickly because we do have a limited amount of spots. For example, one of our workshops called the Da Vinci. And so what you actually get to do is, we've already reserved, it's like a robotic surgery, it costs millions of dollars. But you actually get to use the robotic surgery to, the robot to be able to perform what a surgeon would do using a machine to perform an operation. So it's a lot of hands-on things, which is why the workshops have a limited amount of spots, which is why I wanted to come here and kind of give you all the heads up. I know that sending a flyer to your counselors is, you kind of just see a flyer, but now you can put a face to a name. I'm Catherine, I'm the actual coordinator, and I would love to see you all there. I would love to see your faces there. You don't have to have any type of preparation for it. If you had any interest in pre-med or pre-pharm, I would love to see you all there. If you contact me at my email, then I'd be more than happy to work with you. And I don't think I mentioned the conference is actually January 31st, 2015. So I know it kind of seems far away, but the registration is already filling up. So yeah. So I think for the most part, that's it. Yeah.
Thank you, Catherine. Can I pass this flyer around, and then we'll try and collect it when it gets to the back. Jot down the date and time, and it's a great conference. I'm assuming once they get on the list, they also might receive other information along the way about, pre-pharmacies and pre-med. Okay. Perfect. Okay, thank you. All right, so let me pass this. And without further ado, I'd like to start off the presentation with Veronica on my right. She's going to talk about her pathway. Oh, you want to go down on the other side? Okay.
There's a microphone.
Ramon, you have a microphone, so you can turn that one on. Okay, so we'll start with Ramon, and then I want to hear a little bit about how you got to where you are today, and then just very brief. Everybody gets an intro, and then we'll swing it back. Okay?
Okay, great. Good morning, everybody. How are you guys? Great, awesome. It's good to be here. It's my second time taking part in this event, and I am honored to be here. My name is Angel Ramon, and I'm the field supervisor for Accent Care. I'm one of the employers up here. We're offering many jobs, and I'm excited to say that I've been with Accent Care for about 1.5 years now. My pathway to Accent Care actually started in an entry-level position with the YMCA. I worked with the YMCA for about 5 years. Had a background of management and supervision. Helping young people transition into adulthood helped me realize how important of a role we play in the lives of others, and I like making a difference in people's lives, which is why I'm here today. Give you information about the jobs that we have and so forth. So the opportunity with Accent Care came about 1.5 years ago, and I felt that it would be something that would allow me to grow personally and professionally, while also feeling like I'm still contributing something positive to the world. Personal care has always been something that's been very near and dear to me. My father's 84 at the moment, my mother's 60, so she's always cared for him. But through my adolescence, my parents always looked like a grandparents. So always had to help them with things, the first person in my family to drive, so that's the experience that I had in conjunction with, all the employment experience that I had to carry over into the position that I have now. So I'm basically in charge of hiring, recruiting, training, conducting orientations, and making sure that employees out in the field are comfortable and supported in their everyday role. So a little bit more about Accent Care. We hire caregivers and CNAs to care for people one-on-one in their homes, retirement communities, and so forth. So if you guys are interested, my table's pretty barren, but what I don't have on the table, I have at the office. I have a lot of jobs. So even though my table seems a little plain, we have a lot to offer. So if you're interested in work, or if you need some advice on how to proceed, or maybe a route that you're looking to take to grow in your career, I'd be more than happy to talk to you. Again, my name is Angel, and I'm with Accent Care, and I'm glad to be here. Thank you.
Okay. I hate these, by the way, just so you know. My name is Dina Reinacher, and I'm the program director for MLT, which is Medical Laboratory Technology, and MedOp, which is our Medical Office Professions program, which most of you would probably know that as a medical assistant. I've been here at Southwestern College since July, so I have not been here very long. I came here from Illinois and lived there my entire life, so this is very new to me, and I'm loving it here. You guys are all very fortunate that you live in San Diego, Illinois. How I got here, my background is I have a bachelor's degree in medical technology or clinical laboratory science, and I worked in that field for about 14 years. After working in that field, I decided that I really wanted to go into teaching, so I decided to teach. I started teaching in a medical assistant program, very small college in Illinois, and then they approached me and asked me if I wanted to start my own laboratory science program, so I jumped on that. I began a program there in MLT, worked on it for a few years, and then they decided to close the college, so I was out of a job. I went back to bench work as a laboratory scientist and realized that really my heart and my passion was in education, so I started looking for a job, and that's how I found this one and I've been here. So I've actually been in my field, whether teaching or laboratory science, for over 20 years, and I have a lot of experience in both MA and medical laboratory technology. What else do you guys want to know? I'm glad it's not snowing here. I will say that. I know it's snowing back in Illinois. But we can talk more about what the programs are and what they have to offer you. And if you have questions, please do ask, okay?
I don't need that. My voice carries terribly as it is. My name's Ron Unger. I'm a 20-year professor here at Southwestern Community College, predominantly an EMT paramedic. I also teach in the fire science program. I'd like to start with thanking you all for being here and saying that you're the cream of the crop just for even being here. The fact that you're here means that you have an interest in this field, and I've always told hundreds of students that I believe the field of healthcare, regardless of what job you go into, is a calling. It's something that tugs at your soul that you want to do it. Sometimes the pay's not the best, the hours aren't the best, but the job itself is fantastic. I started off, believe it or not, in the 1970s as a San Diego beach lifeguard. And went to San Diego State, got my bachelor's, my master's in education. Fully planned on being a high school coach and teacher. And one night something changed, and I went on a ride-along after a rescue at OB with a San Diego police officer. And hopefully this will happen to you in your career aspirations and your educational, whether you do the internship at UCSD, which is fantastic because all it takes is one little thing and all of a sudden you go, that's the direction I want to go. And in my own life, I went on a ride along with a San Diego police officer. And he said, you know, this would be quite a job for you. Little did I know, 18 years later, I ended my first career with LA County Sheriff's as a SWAT paramedic. I was a SWAT team member on our Special Enforcement Bureau, and just had a fantastic career with LA County Sheriff's Department in that field. And like I said, came here as my second career at Southwestern College, and I'm just ending up my second and last career. I'll probably be retiring next year, but I've had a fantastic run of it. My expertise is really I run the emergency medical technician program at Southwestern College, but I also teach in those other areas. And I've had the opportunity to watch students start here and end up in so many different neat jobs in the healthcare. I've had students go on to the fire department, I've had students go on to nursing, I've had multiple students go on to become physician's assistants, and I've even had 2 students go on and go to medical school. All of them I'm proud of. All of them I'm very proud of. So I'll talk a little later. I think I'm going to be able to talk a little later about our field and what I'm in charge of, and maybe how that might help guide you towards, what your ultimate career for you would be. Thank you.
tell me I speak too low. Can't hear me. My name is Veronica Pineda, and I work with the nursing and health occupation programs in Otay Mesa campus. For those of you who have not been out there, it's off the 905. It's almost crossing the border. So it's one of 4 campuses at Southwestern College. If you visit the other campuses, there's the Otay Mesa, Chula Vista, National City where the MLC program is at, and San Isidro. So the nursing programs office is based, out there in Otay Mesa. And basically the way I came to work at the nursing programs office is I've always been in education. That's my passion. My passion is working with students. I work with the intakes for the students who are thinking of going into the nursing programs office. Those are the students that I meet with, go over the prerequisites. A little bit more back about myself, you just back up. I grew up in National City, attended school K through 12 there, and then I went on to earn my bachelor's degree in political science and history with Chicano studies. So it's not a pre-med background, but I think that's my advantage in working with students who are going into nursing, because I kind of came in with a fresh set of eyes. And I know that it can be very confusing at times. The prerequisites, the requirements, it just seems like one thing after another. So I think that's my advantage, is that I can help students get some clarity on, the path. Like, this is what you need to take, or this is what you need to do next. Make sure you fill this out. That's where my strength is in this field. On a personal level, I think I relate to kind of what Angel was saying. Angel? Yes. When you start to see the health of your loved ones deteriorate, that's when you kind of start to understand how important it is. And having been in that situation with both my parents, I started to understand how important it is, to take care of your health and have people there that, take care of you. So that for me is what makes these careers very important, because we're all going to be there one day. And we want to make sure that the person that is there taking care of us is skilled, they know what they're doing, we can trust them. So those things are important when you pick a career, when there's just so much involved, so in a nutshell, that's kind of what brings me here, and how I've worked with many students from kinder to college, but my niche is college. And I think we can probably get into more of the details of the programs as we go along. Thank you.
So for the next sequence here, what I'd like to hear from our presenters would be more specific about their program, or what specific trainings are involved to get into the program, what type of services are available. Sandy Ramirez, one of our counselors, she's working with a student right now. She's going to talk about the transfer requirements to go from, let's say, nursing here, pre-nursing, or with an ADN degree to a 4-year college. And so she's going to come, and by the time we get around to her, she can talk about that. But Angel, I'd like to hear more about what services your agency provides, what our students could look forward to working with you. And then for our program presenters also, I'd like to hear about what the first year is like, what the prerequisites are, what kind of opportunities our students would have to get that hands-on feel and exposure. So Angel, please.
Okay, awesome. So, my chairman, okay, so as I mentioned earlier, Accent Care is a personal care agency. It's been around for about 15 years. And I'm not here to sell it to you folks, because the jobs are there. There's minimal requirements to work with us. We look for compassionate, caring people who are professional and who are interested in not only growing, in their own career, but also helping people improve their health and be a companion to these people. So what we do is we provide everyday living assistance to the elderly and disabled in their homes one-on-one. So we help people with basic things like meal preparation, bathing, going to the restroom, light housekeeping, medication reminders, one-on-one in their homes, retirement communities, skilled nursing facilities, and so forth. So with that being said, we look for people who have at least 6 months to a year of experience in this field. But the great thing about Accent Care is that we consider even personal experience, volunteer experience, schooling experience, Can I say personal experience? So we consider at least 6 months to a year of that experience. So it's great entry level work because as the EMT professor has mentioned, there's many types of roles, many types of jobs in this field. And through my experience as a hiring authority, I see that there is a lot of applicants that are either going to directly for a medical assisting job or directly for an LVN job or directly for an RN job, straight out of college or straight out of school or straight after getting a certification, but they're not really, attracted to the employers because they don't have that experience. But see, Accent Care recognizes that you need to get the job to get the experience, but you need to get the experience to get the job. So this is a basic job that really carries you with the soft skills that you have. And so what I emphasize with soft skills is basically your ability to converse with people, your ability to understand people, your ability to have that comforting sense of someone else's hardship, and to fully understand the magnitude of the difficulties that they're going through. So what I look for people in the interview is basically their ability to make me feel comfortable. And I ask myself, would I trust this person in caring for my loved one? Do I feel that this person can be trusted working by themselves, one-on-one with the person? So that's basically the job that we have. A caregiver, a CNA, one-on-one in the home or retirement community. So we need someone to be independent, we need someone to be a self-starter, someone to be confident, someone who's not afraid. And the great thing about it is that you can learn a lot of these skills or even grow your skills that you've already obtained in clinicals or through textbooks and through studying and through tests. You can improve on those skills in a comfortable setting because you're not going to be working necessarily in a facility where you're caring for 8 people at a time. You have to do like 8 showers in a day, or distribute like 6 meds at one time for a certain person and distribute all these things. Accent Care follows a lot of guidelines and protocols, and we trust that you guys will carry that out in the field as well. So it's a comfortable setting for you folks. As far as the way the job works, once we interview someone and we deem them hireable, we like to get them hired within a week just to show them how serious we are. We don't want to waste your time, and we definitely have a lot of work. So we invite somebody on to orientation where we emphasize, all the skills that you have, refresher course on HIPAA policies, protecting your rights, clients' rights, safety, and so forth. And then we get phone calls from clients all the time, private pay clients, workers' comp clients, VA clients. We go out there and we meet with them, create a plan of care to understand how we can help them. And then we don't send people to work, we offer you the work. So the more work you accept to fulfill, the more work you're going to get. And then from there, you accept the work, you go work with people one-on-one in their homes, and then every time you work with a different person, they're going to tell us if they liked you or not, if you did good, what they felt about you, and if they're going to stay on service with us, then you can develop a regular schedule. So as far as the qualifications, they're pretty minimal. I mean, you can talk to me today, and I'd be more than happy to give you some more information. With any of that information that I just shared, does any questions come to fruition? Any questions?
You mentioned the pay rate for certain positions.
Sure.
And hours.
Great. Definitely. So as far as the specifics of the job, I have no shame in telling you, or any doubts or any fear in telling you what the pay rate is. It is a basic entry-level job. And like I emphasized earlier, you're working one-on-one with people. And so at the end of the day, what you make isn't really what you take home, but it's that sense of contributing to other people and understanding that you're making a difference in the lives of others. So our pay reflects the type of work that it is. So CNAs, we usually start at $10 an hour, but that changes though, depending on the level of care, the climate of the case, the location, and the hours. So people who are not CNAs, we usually start off at $9.50, but that always changes though. For example, 2-hour shifts will pay like $12 an hour, but there's not much you can do in 2 hours, and a lot of the 2-hour cases that we get are veterans, VA clients, so you work with them for 2 hours, and if you're someone who's openly available and you're comfortable with going to more than one client in a day for 2 hours, you go to a 2-hour shift, then you go to another one, then you go to another one, that's like 6 hours, $12 per hour, then we'll pay you for the mileage too. So it really adds up. Shifts that are less than 4 hours obviously pay differently as well, they pay higher. And it just depends on the level of care, the climate of the case. And what I mean by that is, if we send you with a client who's, that needs full assistance, they're bed bound, that it's a heavier case, it's a difficult case, then we would offer you a rate differently because of that. So we'd say, Angel, this client has this condition, these are the hours, this is where they live, it pays this much, do you want to do it, yes or no? So that's basically what the pay rate is. We evaluate employees every year, and we've had caregivers that have been with us for 2 years, 7 years, even some that have been there for 14 years. People that work with us as their main job, as their secondary job, as their part-time school job, and it really just depends. We have hours, 24 hours a day, overnight shifts, morning shifts, 2-hour shifts. You can squeeze in some work before school, after school, just to get that hands-on experience. Any other questions? Yes. Oh, one right here, sorry. Great question. So the young lady asked if you have to be certified to volunteer. Not necessarily, but from what I understand, Accent Care doesn't have volunteer opportunities. We offer jobs. Thanks for your question. Another question? Yeah. Excellent question. I know that if you guys are looking for volunteer opportunities, I know that Kaiser has a great volunteer program. And I think you can do it online too. Just Google like Kaiser volunteer program and you can check that out.
So in terms of certifications, in order to work as a CNA, what are the specific certifications that you need?
Great question. So first aid or CPR isn't necessary. You don't have to be a CNA either. Again, we only look for 6 months to a year of experience because we want to build a bond with people early on. We feel that if we give someone the opportunity to prove themselves and they're grateful for the opportunity of working with a company to establish themselves as a professional, then we're going to get that back. So CNAs, I mean, even if someone is in the CNA course, we would take that as experience as well. Let's say they have 3 months to complete it, or if they just started the CNA course, we would still value that because we see the commitment that someone makes. If you pass your CNA test and you don't have your certification, but you have your passing score, we would consider you a CNA, so that would be valid too. So again, 6 months to a year of experience if you are a CNA or if you're going to be completing it. For example, sometimes I interview people and they say, oh, I'm going to take my test like next month. But I see that the person is fully capable, they're smart, and I'm confident that they're going to pass. I would still offer them the CNA rate. So does that kind of answer your question? Okay, great. You had a question right here, man?
What if they've been working or volunteering at a nursing home as an activities assistant?
All that experience is relevant. And again, I want to emphasize how important the soft skills are because this job, as one of the staff members had mentioned, isn't for everyone. You definitely have to have a calling. And if you're someone who displays that commitment during the interview and say, I'm here for the right reasons because I care for people, I want to make a difference in lives, check out this volunteer experience that I have, or I've had this connection with my personal life, this is why I want to do this job. That's what's going to carry you in the interview, and that's what's going to solidify you in getting the job. So any experience that you have, whether it be volunteering in a facility, volunteering with children, having your own personal daycare, I mean, it's all relevant. It just depends on how you market yourself and how you display your confidence through the interview, so that we can develop that trust and get you working with people one-on-one.
Any other questions for Mr. Romo?
You're all day.
Okay. I like to stand if that's okay with you guys. Okay, we're going to start off with MedOp, which is our Medical Office Professions program. You guys will know them all as MAs. The people who, when you go into a doctor's office, sign you in, take you to the back room, do your vital signs, take your health history, all those types of things. Our MedOp program here in Southwestern has 4 different kinds of certificates and degrees you can achieve. If you want to be strictly administrative, you can go that route. It's a certificate of achievement. You can do the clinical route, which is another certificate of achievement. You can do medical billing and coding, which is a certificate of achievement, or you can do the associate degree, which is going to combine both administrative and clinical MA work. So those are basically the 4 routes you have, or choices you have in order to do this particular program. What we do with medical assistants, or what I try to get across to people, is regardless of whether or not you're going to do billing and coding, administrative, clinical, or the degree, you have to like to work with people. Okay? And sometimes you're going to have people, most of the time you're going to have people coming into an office that don't feel well. Okay, so you have to have the ability to have those soft skills that Angel was talking about to be able to deal with those types of situations. Not everybody's sick when they go to the doctor, but the majority of time that's the only reason why they're at the doctor. So you have to be able to work well with people and have a lot of patience. As far as prerequisites for the MedOp program, we do not have any prerequisites at all. You can just decide that you want to go ahead and do that and achieve those certificates or degree. You enroll and you start the program. That's basically how MedOp works. Okay. Let's just focus on that right now before we go to MLT. Are there any questions about the MedOp program specifically? Oh, sorry. Yeah.
My mom did the MA program last year, and she didn't hold most of her story. She did the administration and the clinical part, so she's got more experience.
The MedOp program has actually gone through, that's a great question. She wants to know, she knows someone, her mom, who did the MA certificate and the MA for administrative and clinical. She wants to know if they're both correct, but did she then achieve the degree? Not necessarily, because the MedOp program has gone through a huge revamping and we're in a huge transition period. Prior to this particular fall semester that just started, we had 16 different routes you can take for the Medical Office Professions program. That's crazy. That's way too many, and it's nothing. It's causing way too much confusion for everyone. So what, I'm like, people are gonna be like, yeah. Okay, so what we did was we took those 16 program certificates, degrees, and combined them into 4. So if you really don't want to have that patient contact in the back office, doing vital signs, taking health histories, being in the office room with those patients, but you don't mind filing, taking appointments, doing those types of work, you want to go administrative. If you want to work with a patient in that back office, you want to go clinical. If you want to have the experience all around, you want to do the associate degree, which combines both of those. If you want to do complete insurance type information, billing and coding, basically, you want to go with the billing certificate. We're not going to work with patients too much in that area, but you will be making phone calls, things like that. So it makes it much clearer, much easier to figure out exactly the path you want to take. There's no intermediate, basic, advanced, nothing like that for each certificate. Crazy stuff. It's just you get administrative, you get clinical, you get them both, or you do billing and coding. That's basically it. Yeah. So she wants to know if she's doing a little bit of billing and coding, and she wants to know, is there a associate degree for billing and coding focused on that? No, there's not. But if you get the associate degree here for administrative and clinical, there's one course in there that is the billing and coding. Because we want you to have exposure to that billing and coding in order to achieve that associate degree. But it's not focused on billing and coding, it's focused mainly on front and back office for administrative and medical assistant. Okay, so we'll talk one-on-one about that. She's looking at a grid of courses and things, so it'd be easier for me to just talk to her one-on-one about that. There is a specific pattern or path that we want you to take when you do these medical assisting courses. We want you to start off in semester 1 and take this group of courses semester 2, take this group of courses semester 3, take the next. And the reason is because if you start jumping around and have no set way of taking your courses, it's going to be very difficult to understand the process and follow what you're working toward. The way we've designed the programs now is it's actually flowing. We want to start groups together, have them end together. Build that cohort feeling from beginning to end. And it allows you to actually build relationships. It allows you to work better. You have people you can count on and rely on in those courses and not say, well, I'm going to take this next semester. Well, I don't have that. We're trying to avoid that. Okay. And classes for the medical assistant program are paid. Okay.
Did you talk about pay?
Pay for medical assistants. You know, that's a really great question, and it varies hugely depending on whether you're going to be a certificate of achievement or you're going to be an associate degree. Obviously, you get an associate degree, your pay is going to be higher. Okay? You're also going to be more employable if you have that associate degree because you have the skills of both clinical and administrative. If you really don't want to do clinical work, go the administrative route. And it's going to be a little harder to find a job for the administrative route. As far as pay, honestly, I really don't know because it varies so much. Some places start out around the $10 mark, the minimum mark, and some places, depending upon any experience you've had and work up to it, shift work, those types of things, you could be up to $15 an hour, $16 an hour.
Okay. And just to let you know, I picked up the 4 programs that Deanna was talking about. They're listed right here on this pink sheet. I can pass this around, and if you're interested, you can take one. There should be enough for everybody, but if you aren't interested, pass it on.
Yeah, we have a large group of adult school students that are here. Can you talk a little bit about the articulated classes between the adult school and Southwestern College?
Okay, so basically what you mean is that they've taken a course before, will it transfer over?
Like the healthcare science.
Exactly, and medical terminology and things of that nature. They do transfer over, provided that you fill out a request of substitution form for us to actually look at the description of the course you took, the grade you got in that course. It can't be pass or fail, it has to be an actual grade, it has to be C or better, and then we have to see the descriptions between the 2 courses to make sure that they match. And that's a process you can go through with your counselor. And Danny can talk about that when she was her turn. Any questions else about Meta? No? All right, so let's do MLT. So MLT stands for Medical Laboratory Technician. Our program is Medical Laboratory Technology. That program is an associate degree. And if you are the type of person who absolutely does not want to have patient contact, this is the place you want to go. You will not have patient contact, with the exception of possibly, this is the only disclaimer, if you work in an area where they make you do phlebotomy, okay, which might happen, but it's not the main point of the position. Okay? You're going to be working with patients' blood and body fluids, all body fluids, just so you know. So you can't be squeamish, you can't be queasy about any of that, and you work with big machinery. Okay, so you have to be able to tinker with things, fix things if they break, those types of things. What you learn in MLT is basically how to diagnose and treat diseases. 80% of what a physician does when they treat or diagnose a patient comes from the laboratory. That's a huge number, and a lot of people don't realize that, but what you are doing has a huge impact on healthcare. Our program is 18 months, and that is after all the prerequisites are met. There is a big, long list of prerequisites for MLT that include biologies, microbiologies, human anatomy, physiologies, math, English, communications. You have to have your CPT, which is your California Phlebotomy Technician license. That has to be completed. All of it must be completed before you apply. We do not take any work in progress. Okay? Our application period is from April 1st to June 1st of every spring, because we start cohorts in the fall of every year. So right now we're not accepting students or applications, but we will start accepting applications April 1st of 2015. That application period will close June 1st of 2015. It has to be in by June 1st. That means all of your prerequisite work has to be completed and application in by June 1st. Sometime over the summer, we'll be able to look through all the applications, decide everything based on all of the students that have applied, and we will enroll the accepted students in fall of 2015. As far as your prerequisite work, they have to have grades, can't be pass or fail. The grades have to be C or better, and any of the core science courses have to be a minimum of a 2.7 GPA. Okay. What else am I thinking about? You might be able to help me with this. What did I forget? While we're milling that over, which you can go on. Immunizations, yeah, we do drug screens, we do background checks, we do immunizations. Those are all also prerequisites once you are accepted to the program. So, yes, go ahead.
I have a question for that. If you are offering MLT, why you don't have everything offering here, like
you know what, I can't hear you, I'm sorry.
We need the certification for phlebotomist, but you are not offering here.
No, she's right.
Outside is really, really expensive.
Okay, so I'll answer that question for you. She said we do require the phlebotomy technician license, but we do not offer it at Southwestern College. And she is correct, we do not offer the phlebotomy certificate program. We do have a list of schools that you can go to in order to get that phlebotomy certificate, and it is a requirement. And the reason why it's a requirement is because the MLT program at Southwestern College is only one of 2 nationally accredited colleges within the state of California. What that means is in order to take the national certification exam, you have to be accredited by a council called NACLS, which is a National Accrediting Agency of Clinical Laboratory Science. There are only 2 colleges in the state that have that accreditation, us and one in Cupertino. Okay. Part of a requirement for that NACLS accreditation is the CPT license. That's why. The fact that we do not offer it here, I think many years ago it was offered, however, due to issues of grants being pulled, things like that, and financing, we no longer have that program available. But it still has to be required in order for the program to be accredited.
How long does the certification last?
Okay, so once you get certified as an MLT, is that what you mean? Phlebotomist? Okay, so phlebotomy licenses for the state of California require you to keep that active every 3 years. So say this month, November 2014, you would be certified. You have until November 2017, I think it's 3 years. 2 or 3 years. To earn 30, I'm going to get it wrong, I'm getting mixed up with MLT. 16 CEUs, which is continuing education units. So sometime within those 2 or 3 years, from the month you get certified to the month it would expire, you must have 16 CEUs to keep it active. You let it lapse, you will have to recertify, which means taking another exam. Okay. Yeah.
I just wanted to add something about the phlebotomy license. With the phlebotomy license, although it's not offered here at Southwestern College, there on the MLT website there is a list of programs in San Diego County. They range from a few months to a semester. From what students have told me, the phlebotomy programs that are a couple of months are the more expensive ones. So we're talking a couple $1,000s. That's a lot of money. And so some people need a phlebotomy license now, so they go through that and they pay all that money. So that's one option. It's totally, depending on your circumstances, with how fast you need it. That's one option. On the other end, there's programs that are a semester. So they're more affordable. They're more time, so you get to practice and do the actual blood drawing and all that. It depends. It's totally the student's preference. If you need to do it fast, do it now. Then you're gonna most likely have to go into a program that costs more. Versus the other programs that are semester long, they're more affordable. You get to take your time a little bit more. And but those programs that are semester, I've heard, are sometimes waitlisted because they're pretty popular. So there may be a wait list. And there's private, and then there's I think Rosemont Health Occupations has that semester program. There's about 5 or 6 programs on the MLT website that have that phlebotomy license program.
And if you want to have me send you any information, stop by the MLT table, write your name and email down and any specific information you want. If you want me to mail you specifically what those areas or schools are that offer for CPT, I'd be happy to do that. So that way you don't have to go searching on the website. One thing I do want to add about the website for MLT is it does contain our MLT student handbook. It's about 40 pages answering anything and everything you would want to know. Right down to, hey, I took biology at Grossmont College. Is that going to transfer over for you guys? It'll tell you that. There's a grid, the very last page. It'll list the area colleges and it will say, Grossmont Biology XYZ will be substituted for our biology XYZ. Okay, so that'll give you an idea. Instead of calling or asking or emailing everything about, hey, will this course be taken? That grid is there for because of that. Okay. What else? Yeah. Salary pay rate for MLT. It ranges in the state of California. This is a statistic from January of 2014, so it's a fresh statistic. $37,000 to $56,000 a year, so the average is about $47,000. That's a huge disparity from low to high. Reason being is because MLTs can work in physician office labs, which means you would probably be the only one there, one other tech there, and your primarily days Monday through Friday. That's a pretty good schedule. Your pay is going to be lower. Then somebody who works in a hospital setting, third shift, 11 p.m. to 7 a.m., can work weekends, can work holidays, 365 days a year, 40 hours a week of work. That's going to be more of the $56,000 a year range. So it's because of the differentials that you receive, basically working on evenings, nights, days, those types of things. Yeah. Yes. She's asking about the scheduling for the MLT program. MLT program, you start and end within 18 months. The first semester is all didactic work, which means you're in the classroom. Those classroom classes do have a lab component, but you are basically at National City the entire semester. There are classes for the first semester, hematology, chemistry, immunology, and urinalysis. All within the first semester. It's a very, very intense semester. Okay, you'll pretty much know, and then introduction to clinical laboratory science too is also that semester. Which, by the way, if any of you are thinking, hey, MLT might be for me, but I'm not sure, we do let you take MLT 80, which is that introductory course, without being part of the program. So if you say, hey, you know what, I think I might like to do this, but I'm really not sure, go ahead and give it a try with the MLT 80. The second semester, you take what you learned from that first semester and you apply it at a clinical setting for the first 6 weeks of the semester. And that means going to work at 7 in the morning, being done at 3:30, and applying what you learned. You do that 40 hours a week for 6 weeks. Then the second half of the semester, you come back and you take another course, which would be chemistry and microbiology. Your third semester, which is summer semester, you apply chemistry and microbiology to that clinical setting. And then the second half of the semester, you take blood banking. Your last semester, which is your fall semester 1 year later, is completely at a site. You work 40 hours a week, right next to a CLS, which is that bachelor's degree scientist, and work as an MLT. Okay? And you do have to follow that pattern. It is full-time. It is days for your clinicals, evenings for your courses from 4:30 to 9:30 every day of the week, including Friday. Okay? A very high number. This last class is actually this current class that I have. It's going to be graduating at the end of December. 17 started, 17 are graduating. Right now I have 16 that started this fall, and they're going to continue on to the next term. Once you continue on to that second term, you're pretty much going to be in it the whole time. I think out of all of the students that have graduated, we've maybe lost 4, 5 in the 5 years that the program's been running. Okay? And that could be for various reasons. Decided it wasn't for them, grades, whatever the case may be.
Could you talk a little bit more about the CLS program and the differences between MLT and maybe the range for that?
Sure.
As well?
So MLT is the associate degree. That's what we offer here at Southwestern College. CLS is a bachelor's degree program. They offer it at SDSU and UCSD. Okay? Too many acronyms. Okay, so they offer it there. The majority of time, what people do is they go for that MLT first, which allows them to, after 18 months, work in the field. And as they're working in the field, work toward achieving that CLS while they're working in the field. Sometimes your employer will even offer you tuition assistance because you're benefiting them by increasing your degree. As far as why not just go and do the CLS first? Why do I have to take that middle step, that middle stone, and kind of step up? One of the biggest benefits I can see for that is when you take someone entering a CLS program, 2 people, one person has an MLT, one person has no background in laboratory science, who's going to have more of a chance of succeeding? The person with the MLT background. They know the terminology, they know what to expect, they know all these things, they're familiar with the rigors of a program like that, and they've already committed to one and finished one, they're more likely to finish a CLS program. As far as pay, I can only speak from my personal experience, and this would be Illinois, but it'll kind of give you an idea. Because I don't look at CLS values since I'm an MLT program. But the background from an MLT would make anywhere from $29,000 to $40,000 a year. Now remember, this is Midwest, so it's very different from here. $29,000 to $40,000 a year. Your CLS would make probably starting at $45,000 and max out at $75,000. So there is a difference. There is a definite difference. But sometimes it's better to take those steps and work towards getting it at a slower pace to ensure your success. Well, nothing? That's it? Okay, sure, absolutely. Okay, great question. As far as, are there any internships or externships for the MA program in order to finish? Yes. It is done only in your last semester, and it's called the work experience. So you'll take every single thing that you've learned from the previous 2 or 3 semesters, and you'll go and work out in the field. What we are working on right now is we do have some affiliated institutions that we are working with, but let's say you went ahead and got the clinical portion only of your certificate. We're going to place you in a site that's going to allow you to do clinical work. You're not going to do a clinical certificate and then have to go and file for Home Depot. Okay, that just doesn't make any sense. Okay, because your work experience has to be right in line with what you studied. So we do have work experience in your last semester. All right.
Okay, so what what I think I'll start with is just a brief explanation in the EMT paramedic program. Let me just start with the difference between those. People get those mixed up all the time. An EMT is an emergency medical technician, and they work in the ambulances that you see driving around San Diego. And a lot of what they do is inter-facility transport. So they pick grandma up at dialysis and they transport her back to the convalescent home, or vice versa. They typically are going to make in the $12, maybe $14 an hour range. They are not typically a career job. People are doing that job because they've got their sights on something else. The other reason people go into that more basic EMT is to gain patient contact hours. Those patient contact hours are extremely valuable for careers in medicine. For instance, to go to a physician's assistant school, they require something like 1,600 hours of patient verified contact time, which is very difficult to get volunteering at a hospital. I'm not saying you couldn't do it, but you might as well be getting $12, $14 an hour while racking up those patient contact hours. The other reason people do that more basic EMT is because, like I said, it's an entry-level position using for a stepping stone to go somewhere else. A lot of the folks we get are interested in becoming firefighter paramedics. Now, you go firefighter paramedics. Well, a firefighter, about 85% of his job is running medical calls. And so they love to hire EMT paramedics. Now, paramedic is the what we call advanced life support. Those are the men and the women that you see in the ambulances and in the fire trucks, and in my case, a SWAT vehicle, and some in a helicopter. They're the ones that treat patients that need drugs, that need heart medications, that need defibrillators, they need airways put into their throats. Those are the more what we call advanced life support. Now, as a civilian paramedic, those folks, believe it or not, only make about $14 to $15 an hour as a civilian. If they go to the fire department, which almost everybody ends up doing, they're more starting at about $65,000 a year, depending on, of course, which city. San Diego tends to pay the worst. Places like Los Angeles, where I came from, and San Francisco, tend to pay the best, and those are the starting pays of $65,000 to $75,000 a year. So now, one other aspect of the emergency medical technician is a lot of folks I've had, when they take our EMT program, as part of our EMT program, they get a good exposure, and they get to do the ambulance ride, and then they get to go work in an emergency room as an ER technician. And I lose a lot of my students, and I do it joyfully. I say I lose them, but I joyfully lose them to the nursing program. I'd say my EMT class, say we put 100 students through that program each year. I bet you we lose 5 to 10, maybe even 15 to the clinical time. Because they go do their they go do their clinical time in an ER, and they get it's a very adrenaline type job where you go in, 10 hours goes just like that because you're dealing in an emergency room. And I don't want to horn in on the RN program, but we are associated with them in that sense. Now, that would be the other job that EMTs do, is working as an ER tech. Now, they typically make a little bit more than the ambulance folks. I have several of my TAs that are currently ER techs at UCSD. I have a couple at Sharp, Chula Vista, and they typically make in the $15, maybe $18 range an hour. Now, and they're gaining hours to go to physician's assistant school, even though that's not a requirement for, and if I misspeak, please tell me, for the RN program, those patient contact hours, students that I've had that have gone through my program and gone to nursing have done very well in the nursing just because they have that background of patient contact. They know how to talk to patients and that. Now, the actual classes that you would take at Southwestern College, the prerequisite for EMT 113. And EMT, you can tell I'm a teacher, I feel terrible without a whiteboard. EMT 113, which is the EMT basic, you simply have to take EMT 109 and EMT 101. Those two classes, one's a CPR class for the healthcare professional, the other is a first responder. Typically, students would take both of those in the fall. EMT 101 is 1 unit, EMT 109 is a 3-unit class, so you can always take other classes. We also get some people that take these classes that just simply aren't sure what they want to do. They know they want to be in the healthcare field, specifically emergency medicine, but they're just not quite sure, and that light hasn't all of a sudden gone on that's what I want to do. So they'll come in and take this class, these two classes. EMT 113 is also offered on one semester classes, and it is a little greater. It's actually an 8-unit class, and they do that all in one semester. EMT 113 is a certification class to get your national registered and state certified emergency medical technician. That's the career that I told you about where they transport grandma from clinic to clinic and do inter-hospital transport. And then also in the ER as an emergency room technician working alongside nurses and doctors. The little latest thing is that I have heard, and I follow what's going on in the field very closely, is the ERs are loving hiring EMTs that also have their CNAs. Those folks go pretty quickly when they go to apply to the emergency room. And then, is that better? Oh yes. Usually we don't need those, but I don't need those, but that's okay. So EMT 113 is as I said, it's about an 8-unit class. The only prerequisites are 109 and 101. So you would come in, do these in the fall, and then do this set of classes in the spring. It's then at that point you can make a decision: do you want to work the field or do you want to work the clinical? Now, just for jolly's sake here, the EMT paramedic program, which is the advanced life support that I talked about, and that's typically the folks that want to go fire department take that class. That is a 1-year-long class, and it's full-time that entire year. And the actual cost of that program run about $3,500 for the entire 10 months.